Hello everyone, this is Dr. Suresh Patil. I'm a joint replacement surgeon over 15 years of experience practicing in the United States. I'm the only orthopedic surgeon who is an American board certified practicing in Pune. I specialize in a minimal invasive joint replacement surgery as well as robotic and revision joint replacement surgeries. So I'm going to talk about different type of arthritis of the hip joint. We'll start with osteoarthritis of the hip joint, which is a chronic degenerative changes into your cartilage of the hip joint. That is a normal wear and tear of the hip joint causes degenerative changes in the cartilage, which is a cushion at the end of the bone and causes pain, inflammation, and restriction of the range of motion. The second type of arthritis that causes hip pain include inflammatory arthritis like rheumatoid arthritis, which is a common cause of hip arthritis in India, where you will see inflammation of the joint secondary to the autoimmune disease of your joint causes restriction and synovitis of the joint. The third type of arthritis include post-traumatic arthritis, where you had a history of trauma or fracture of the hip joint, which causes damage to your cartilage, causes damage to the circulation of your femoral head, which indirectly causes hip arthritis and pain related to your hip joint. The next common cause of hip arthritis include avascular necrosis, which we are commonly seeing nowadays. That means avascular necrosis of the femoral head. As the name implies, it causes reduction of the blood circulation or damage to the blood circulation to your femoral head, indirectly which causes damage to the cartilage and femoral head, which causes incongruent surface of your femoral head, indirectly causes arthritis of the hip joint. Currently, we are seeing this type of arthritis commonly, possibly secondary to recent evidence of COVID, which causes thromboembolic episode of thromboembolic episode in the blood circulation, or could be secondary to the corticosteroid or the steroid used for the treatment of COVID, that is coronavirus. So long-term use of steroid or high-dose use of intravenous steroid causes reduction of the circulation to the femoral head, which indirectly causes avascular necrosis and indirectly causes damage to the cartilage. The other cause of avascular necrosis include heavy drinking of alcohol. That also causes distribution of the fat from the different part of body into the femoral head and causes increased pressure inside the femoral head and causes damage to the circulation and indirectly causes avascular necrosis of the femoral head and cartilage damage. Then, if patient has a congenital or developmental problem related to the hip, like a hip dysplasia, or early diseases of hip joint like a Perthes disease, where you reduce the circulation of certain part of the femoral head. These are the changes or early damage to your hip joint can causes early arthritis of your hip joint. And septic arthritis, that means if you had a history of sepsis to the hip joint, which indirectly causes damage to the cartilage and eventually can cause arthritis of the hip joint. So these are the commonest types of arthritis we say in the Indian patients. The common cause of hip arthritis in Indian patients include rheumatoid arthritis, avascular necrosis of the femoral head, and post-traumatic arthritis. These are the three common types of arthritis we are seeing in the Indian populations. While in the United States, I have seen osteoarthritis, which is a wear and tear of the cartilage, is a common type of arthritis causing hip pain in a patient in the United States. So if you have any question or concern about your hip pain, please reach out to us. And please subscribe our channel so we can create more educational videos for the patients. Thank you for listening.